Okay. All right. Hello, everybody. And thank you, everyone, for tuning in today's webinar, supporting fair work and access to assistance programs. Today, we are honored to have Roseann from the Santa Clara County Social Services Agency as our speaker to provide us some insights around this topic. So first of all, we'd like to introduce ourselves. My name is Stephen Huang, Business Development Consultant at Asian Inc. Joining us today are my wonderful colleagues, Tom and Laura. As a reminder, we recognize the sensitivity regarding this topic presented today. So a recording of this presentation would be available to view and share after this presentation from our website and our YouTube channel. First, allow me to introduce my organization, Asian Inc. Asian Inc. is a San Francisco-based nonprofit organization that empowers equity through affordable housing, financial literacy, and business development for over 50 years. We are part of the business development team, and our business technical assistance program focuses on promoting the growth of local, small, and socioeconomically disadvantaged businesses through access to capital, access to procurement, access to contract opportunities, and access to new markets. So on top of our usual business technical assistance program, we have a big focus on promoting fair equity for everyone, not only for business owners, but for the whole community. Next, my colleague Tom will introduce our program with the Santa Clara County Office of Labor Standards Enforcement.
Thank you, Stephen. My name is Tom. I'm a consultant here at Asian Inc. So with our partnership with the OLSE, we are able to provide valuable, up-to-date resources and information on labor laws, issues, and rights to people through our live workshops and training sessions, just like this one. With a focus on underserved communities here in Santa Clara County, we aim to educate people on their rights at work to foster safe, fair, and lawful workplaces. So whether you're a business owner or a member of the workforce, we have resources to help you stay informed and empowered. So with that, I will briefly go over some free and important resources that we offer for workers, employers, as well as community members. So we have a free legal advice line hosted by attorneys with our partners at Step Forward Foundation. So they operate this number from Monday through Friday, and they can help you with any labor issue or employment issue. And for a more worker-focused line, there is the Catherine and George Alexander Community Law Center, which has a focus on community labor help. And with the recent changes around the new administration, we have noticed a rise of fear and uncertainty in our communities. And that's why it's more important than ever to stay informed and protected. If you or someone you know is a witness or victim of immigration enforcement activity, collect as much information as you can and call the Rapid Response Line for support. They offer free legal aid as well as legal accompaniment and free legal aid for affected individuals, and they have a network to notify of the situation. And last but not least, Asian Inc. is running an entire series of free training and workshops. Join to learn more about your rights, protections, and responsibilities in the workplace on topics such as wage theft, discrimination, harassment, immigration enforcement, and much more. You can sign up through this QR code on the right side or by going to linktree.com/OLSE project. Follow us on social media for the latest updates on affordable housing, financial literacy, business development, and labor information. If you would like to become our client, scan this QR code on the left-hand side or contact us directly at our office or by email. And without further ado, please allow me to introduce today's speaker, Roseann. With over 30 years of experience in public affairs and community outreach, she leads efforts to expand access to essential programs like Medi-Cal, CalFresh Food, and cash assistance, ensuring communities stay informed, supported, and connected to critical safety net resources. Roseann, the floor is yours.
All right, good afternoon, everyone. Nice to be here. Thanks for the invite. We're happy to always collaborate with all our community-based organizations that are out there doing that good work every day. Thank you for asking me to come. Oh my goodness, hold on. She has been asleep for a very long time. Let me please handle this. I'll be right back. Okay?
No problem.
So as a reminder again, so this webinar recording will be published on our website and our YouTube channel after this today. So please follow us on all the social media website and to get the most up-to-date information. All right, Roxanne's back.
About that. I let you literally, she's a real older dog and she'd been asleep for the longest time. All of a sudden decided she wanted to stand up and bark at me. Okay, thank you for being understanding of that. All right, so I'm from County of Santa Clara Social Services. Because you're also based out of San Francisco, there might be some people on this call that don't live in Santa Clara County, but all the public benefits that I'm telling you about are the same all across the state of California, available to everyone, no matter what county you live in. There are some changes about where you may apply, depending on where your county is. But I'll point those out during my presentation so that if you're from a different county, you'll know where it might be slightly different. So let's get started. We're going to talk about public benefits. All right. So covered in this presentation, we're going to talk about health coverage, which is called Medi-Cal in California, Medicaid on a federal level, but the same program. Food assistance, which is CalFresh Food and CalFresh Employment and Training. Financial assistance for adults with dependent children, which is CalWORKs and CalWORKs Employment Services. Refugee cash assistance. Trafficking and crime victims assistance program. Financial assistance for adults without dependent children, which is called the general assistance, and cash aid program for immigrants. And then we're going to talk about some general information about how you apply. And this may be a place where it might be different if you live in San Mateo County or San Francisco County. And I'll point out the things that are the same and the things that would be different. Okay, Medi-Cal is the largest program that we have. About 460,000 Santa Clara County residents take part in the Medi-Cal program. It is California's version of the federal Medicaid program, health coverage program. This is a public health care program for California residents with low income and resources. It's a large program that provides a range of free or low cost health services aimed to assist Californians to meet their medical needs. The federal programs are administered by states. And so every state changes Medicaid into some version, some name that fits their state, and we Calize everything for California. So I'll point that out throughout the program because you might hear someone talking about recently changes in legislation that would affect the Medicaid program that will also affect the Medi-Cal program. So Medi-Cal eligibility is based in the following: the county residency. You have to apply in the county you live in, but as I said, available statewide. It is based on your tax household and your family size and your income. Full scope Medi-Cal, regardless of immigration status, is a California only change. It was implemented in January of 2025, where you would get full scope coverage regardless of your immigration status. And we had about 60,000 individuals who were either on restricted scope or newly signed up who have taken advantage of that in Santa Clara County since that change. Unfortunately, the governor's budget for 2026 is changing that. If you are currently on full scope and say you have no legal documentation to be in this country, you will still be able to keep your full scope Medi-Cal, but you will start to have to pay a $30 a month premium. If you don't have coverage, if you sign up between now and December 31st, you will be able to keep your full scope coverage, just paying that $30 a month premium. If you do not sign up before the end of 2025, when you sign up, you will get only restricted scope coverage, and I'll tell you what that is when I show you what full scope is. And then property also is not counted in California for those over 65 or disabled. That was a change that happened in 2025 and also is falling victim to California's budget changes. And now there will be property counted in 2026, and that could potentially change the coverage for some people on Medi-Cal. Medi-Cal services, full scope coverage regardless of immigration status until 2026, meaning everyone who has Medi-Cal can access all of the following services: doctor visits, hospital stays, emergency care, dental, vision, prescriptions, mental health and substance abuse, pregnancy and postpartum care, family planning, x-rays, tuberculosis treatment, and renal dialysis. Restricted scope coverage, if you do not have immigration status that is legal under the eligibility rules to be able to get Medi-Cal services in 2026. If you sign up after that, restricted scope coverage is emergency care, pregnancy and postpartum care, renal dialysis, and tuberculosis treatment only. Dental Cal is available. It's dental coverage for both children and adults. Adults 21 or over are eligible for limited services. It covers currently x-rays and exams, cleanings, fluoride treatments, fillings, and full dentures. The coverage in 2026 for those who are 21 and over are going to be changing due to the budget changes, but we have not received yet the letter that we get explaining exactly how they will change. And then other medically necessary dental services. To locate a dentist, you don't contact us, we just give you the coverage. And to locate a dentist, you have to look on the Dental Cal site or call the 800-322-6384 number. Food assistance which is called CalFresh Food in California. Once again, it's a Cal something. CalFresh Food is California's name for the federal food program called Supplemental Nutrition Assistance Program, or SNAP, the acronym SNAP, that used to be known as food stamps. When it was food stamps, it was stamps in a book, and you had to tear them off and give them to the cashier. That is no longer the case. So please don't fear that everybody in the grocery store would know that you were on a government program. Now it's an EBT card that is like a credit card or a debit card. You put it into the card reader, you put your PIN number in. Nobody knows that you're using a government assistance program. It is a nutrition program for California residents with low income that increases your food budget, allows you to buy healthy foods at most stores, such as food outlets, grocery stores, farmers markets, and some restaurants. CalFresh Food eligibility is based in the following: Santa Clara County residency, citizenship status. Citizen children are eligible even if their parents are not. So if you have kids that are born in the United States, they are U.S. citizens, and they can qualify even if the parents have no documentation to be here. Family size is an eligibility part, and your income to try to determine if you're eligible, and if you're eligible, how much benefits you will receive. There is a CalFresh employment and training program that helps people get trained or retrained to find employment by helping them with supervised job search, vocational training, work experience, adult education, and job retention services. You can find out more about this program by visiting our website and looking up off the CalFresh page, the CalFresh Employment and Training Program. Financial assistance for adults with dependent children is the CalWORKs program. CalWORKs it's an acronym that stands for California Work Opportunity and Responsibility to Kids. It helps families with children and pregnant women to meet their basic needs. CalWORKs provides time-limited cash assistance, childcare, and healthcare coverage. This program also helps you find and keep a job, pay for education, and provides other services that will support your family even after leaving the program. You can have services for up to 2 years after your income not eligible, so you eligible for the program. So say you participate in our finding a job, getting re-educated, and you get a job that makes you not income eligible for the program. There are still some services such as you keep your health coverage and your food assistance at the same level before you after you get a job for 1 year, and you can have also child care services for up to 2 years after. So it doesn't just dump you off right after you become employed and aren't eligible for the cash assistance part. It helps to try to support you to get on your feet a little bit better and support you at keeping that new job that you have. That is done through the CalWORKs Employment Services. Adults must participate if they are able-bodied in the welfare to work activities for a required number of hours unless they have an exemption, meaning maybe they have a disability or they have a very young baby. There's some reasons why you can be exempted from welfare to work activities. And the CalWORKs Employment Services helps participants prepare for and find a job to achieve self-sufficiency through the welfare to work activities. This is the only program in our social services umbrella who also has money to help with housing and paying like back utility bills and helping with a lot of extra things. The employment counselors that you work with when you're on CalWORKs Employment Services provide you a number of services to help you. And if you take advantage, it can really be successful. Refugee cash assistance is a cash assistance program that provides financial and medical assistance during the first 4 to 12 months of residency. It was 12 months until the current Trump administration took over. And then if you, as of May 1st, 2025, if you apply for refugee cash assistance, you only get it for 4 months. But if you had applied before May, you're still getting it for 12 months. That's why currently I'm telling you 4 to 12 months. Once we get past May of 2026, this program, unless there's a change to it, will only last for 4 months. And they have work requirements that unless you have an exemption, individuals must participate in employment and training activities that include English language training, vocational training, and job placement services. So they also try to help you acclimate to being in this country and getting the training and earning the language and work with you to get a job. Trafficking and Crime Victims Assistance Program. It is provides short-term cash assistance to certain immigrant survivors of human trafficking and other serious crimes. So it is, you a requirement that you are working with the police to try to prosecute your trafficker. And they help you for a limited amount of time with cash assistance. Financial assistance for adults without dependent children. Sometimes this population has children, but they're not their current dependents. So this is the General Assistance Program is run and funded by the County of Santa Clara, but it is a program that is required for every county to have a general assistance, and some counties call them a general relief program. So if you live in another county, there is a program in that county for single adults or maybe a married couple, but most of the people on general assistance in our county are single adults without any current dependent children. They provide cash assistance and employment services to adults with no dependent children who have no other means of support. And all individuals who are able to work must make a good faith effort to obtain and maintain employment. They work with employment counselors to help you find a job and have employment training activities, vocational training also. There's cash assistance program for immigrants. It provides cash assistance to aged, blind, or disabled immigrants who are not eligible for SSI or SSP program. So on a federal level, if you're aged over 65, blind, or disabled, you can apply for, and if qualified, receive SSI benefits. If you do not have the correct citizenship status, you will not be eligible for the federal SSI program. So the state of California has a program which is called Cash Assistance Program for Immigrants that provides about the same amount of money as the federal program does for people who live in our state who are aged, blind, or disabled immigrants and don't have the immigration status to get the federal level benefits. Okay, so now I'm going to talk about general information, and I'll point out the places where it is the same in no matter what county you live in the Bay Area and where it might be different. So ways to apply for the programs that I just referenced. The easiest way to apply and the way, and that is true in any county in California, is by going online to benefitscal.com. You can just make the application and get it sent off, or you can set up an account on benefitscal.com and you can upload any verifications we need from you. You can track any reports you have due once you're on benefits. You can communicate with us if you have an account on BenefitsCal. So it's a way to apply for and manage your benefits. You can call us on the telephone. This is Santa Clara County's number only, 408-758-3800. But every other county has a phone number that you could also call them on. The regulation to accept getting your application started by phone is statewide, so you could call in that county. You can fax us. Nobody ever faxes us anything, but we still are required to provide a fax option, and that is a Santa Clara County only fax number. Or you can mail us. You can pick up an application in any one of our lobbies. All lobbies in the state of California, social services lobbies or human and health services, some counties call their department, has to have applications available in the lobby without even talking to anyone. You could go to the window and ask for one, and you could mail them. Also, our website in Santa Clara County, that is at the bottom of that page. If you just Google County of Santa Clara Social Services, it'll pop right up on the choice. You can download an application there. You could fill it out and mail it back to us, or you could actually fill it out, take a picture, and upload it to benefitscal.com, or print it out and drop it in at one of these locations or in one of these drop boxes. Or you could go in person. This is Santa Clara County information only. All other counties have offices where you could go to apply in person. If you have a language problem, you don't understand English, we have interpreters at all our offices. If we do not have the language available with staff right there, we both on the phone or in person, we can call the language line and get you interpreter services. If you also have any disabilities that make it hard for you to understand filling out forms, or you need help in filling anything out, you can ask for that additional assistance and we will provide it for you. Those regulations to provide that kind of service are true statewide. So our offices on Center Road, our Benefit Assistance Center, which is our big application office at 1867 Center Road in San Jose. The General Assistance Services, couple buildings down from Benefit Assistance Center, is 1919 Center Road. I would only suggest you go to that office if you're applying for general assistance, because that is the specialty office for that program. And better to go to one of the other offices if you're not applying for general assistance. North County is at 1330 West Middlefield Road in Mountain View, and South County is at 379 Tompkins Court in Gilroy. And now we have some questions, I believe, that were already set up, and I will start by answering those. Okay, I'm not sharing anymore, right? Or am I?
I think it's still sharing on your screen.
Okay. I don't want to share that anymore.
Yeah, I just sent a request for stop sharing, see if you're able to receive that request.
Okay. No. Why is it doing this? Okay. I just have share, not stop share. Okay. There you go. Thank you for helping me out of that.
No worries.
Okay, so the first question one of the attendees asks is, what if I'm a green card holder? Will I get less assistance than a citizen in Medi-Cal and CalFresh?
Will not get less assistance as anyone else. If you're a green card holder, meaning legal permanent resident, you will qualify for both your citizenship status qualifies you both for Medi-Cal and for CalFresh Food. The only thing else that we take into factor is your income. And for Medi-Cal, if you're over 65, your liquid property, like money in the bank or money in a 401k, that would be the same as for a citizen, and you would get the same amount. Say you had the same exact income. So just for a round number, let's say your income was $1,500 a month, gross income. And a citizen's person was $1,500 a month. You would get exactly the same amount as that person if all the situations were the same in your case.
Thank you. The second question is, will receiving these assistance have negative impact on applying for citizenship in the future?
So currently, there is something called public charge, which is a thing that when you are applying for immigration status, they look at, you're going to charge the public, the U.S. government, extra money for you being here. Currently, the only programs that we talked about in this presentation are the cash assistance programs would be considered. So if you applied for and were receiving CalWORKs, general assistance, refugee cash assistance, or trafficking and crime victims assistance, any of those cash programs would be considered when you apply for your immigration status. Does not mean that you would be denied because of it. It just means that it would be considered. Now, during the last Trump administration, they expanded public charge to both include Medi-Cal and CalFresh Food. They have not done that yet this time. And then when the Biden administration came in, they reversed that rule and made it only financial assistance programs again. And currently, right now, it is only the cash assistance programs. I don't know what the future will bring.
Thank you. One more question from the attendee. What are the requirements to be accepted to general assistance?
General assistance, you have to have less money a month than they would give you, which the maximum amount they give a single person is $393 a month. Only $150 of it come to you in cash. And if you live somewhere, the $193 would go to your landlord. So you would have to have less income than that to be able to qualify for it. So most people who apply for and receive general assistance have zero income. Also, you need to have pretty close to not very many assets. No liquid assets, no money in the bank, no 401k, no retirement savings. And they even consider your car. And the car has to be, that number just went up. It was around $5,000 and it went up a little bit, and I don't remember it off the top of my head. So that program is pretty, you have to be pretty low income to qualify for it.
Okay, and here are some frequent asked questions. Can I apply again if I was denied before?
Absolutely. If you were denied within the last 30 days and you do not agree with our denial, you can appeal your denial and have it re-looked at. So you don't have to fill out a new application. If it has been more than 30 days and you didn't disagree with us, you had no disagreement, but your situation has changed, you can apply again.
Thank you. Can I apply for benefits for my children only?
Yes, but your income is counted for those benefits. Like for the CalWORKs program, that cash assistance program, that program can even be for an adult. Say you are a grandparent and you end up with your son's two kids. Your son's unable to take care of them. And before you were doing okay on the money you were making, but now you have two other kids living there and you can't afford it anymore. You can apply for CalWORKs just for those kids. And only the money that those kids bring to your household, say if they had a deceased parent and they were getting SSI benefits, if they had money that was attached to a child, would be counted. You could just apply for the kids. If you are applying for, you can just apply for Medi-Cal just for your kids, because the Medi-Cal income limits for children are much higher than for adults. So you could just apply for your kids. For CalFresh Food, but both CalFresh Food and Medi-Cal considers your income. It's kind of like an umbrella. How many people in your household? How many people under your own umbrella? And then whose money counts? Everybody in your household monies count. And then, but who are you applying for benefits for? So say you had two parents and two kids. The parents both do not have legal documentation to be here. And just for a round number, let's say the parents make $2,000 a month gross income. you could apply for those, and the two kids were born in the United States, so they're citizens. You can apply. You have to apply for using your name. You can't just apply, adult has to apply. But you can apply for your kids. We would prorate that income. We would get each person in that household $500. So the two parents would not get any benefits. So we would look at $1,000 for the two kids, and the two kids would get benefits based on that portion of the income.
Thank you, Roseann, for sharing your insights with us today. We truly appreciate your time and expertise. And thank you for everyone for tuning into for today's webinar, Supporting Fair Works and Assistant Access to Assistant Programs. We are grateful for your participation. All the relevant resources will be available on our websites. If you would like to learn more about Asian Inc. and our business development and labor standards enforcement program, visit our website at asianinc.org/business and follow us on our social media. We will be hosting more webinars in the upcoming months. Please subscribe to our newsletter for updates. That concludes today's session. Thank you again for joining us. Have a great day.
Thank you.
so much, Roseann, today.
Thank you. Thank you very much for inviting me. Have a great day, everyone.
Thank you, Roseann. Have a great day as well. And thank you everyone for joining. And that concludes our session. Thank you.